Quick question. Do people come to you for answers at work? Maybe you're managing projects, training new hires, or just the one everyone relies on. That's leadership. Through UVA Darden's part-time MBA in Roslyn, we help professionals like you turn real-world experience into recognized leadership credentials without stepping away from your career. Whether you work in healthcare, education, government, or business, this is how you take the next step. Learn more at darden.virginia.edu/PTMBA.
You're listening to In Good Health, the trusted news source for medicine, science, and technology. I'm Elizabeth Westfield.
I'm Mayan Vasta Betancourt.
And I'm Greg Johnson. This week, why we need to have a prevention-first mindset.
When things are well taken care of, people tend to forget. We need to look to history and remind ourselves of the way things could happen and what we need to do to prevent them from happening again.
But first, why you should consider brain donation after a loved one passes.
He had a really beautiful mind. I mean, his brain was something very special. So the idea of his brain just being wasted was just horrifying to us.
All that and more this week on In Good Health.
Amazon Health AI presents Painful Thoughts.
Why did I search the internet for answers to my cold sore problem? Now I'm stuck down a rabbit hole filled with images of alarmingly graphic sores in various stages of ooze. I can clear my search history, but I can never unsee that.
Don't go down the rabbit hole. Amazon Health AI gets you the right care, fast. Healthcare just got less painful.
Sierra has all the best active and outdoor brands for the super athletic stuff, like running gear for cruising up the trail. Woo! And the super athletic-ish stuff, like fishing gear for chilling by the creek. Nice cast. Fitness apparel to push for higher reps. You got this. And golf balls priced so you can afford to lose one. Or a few. Head to Sierra or Sierra.com for the brands you want at the prices that let you do it all. From athletic to athletic-ish, Sierra's got it.
Kathy Stein saw how her brother Eddie lit up every room he walked into. His enthusiasm for life was infectious. Eddie would talk to anyone about his favorite hobbies, from steam trains to photography. It was hard to catch him without a camera or two strapped around his neck. But after Eddie was diagnosed with a terminal disease, he, Kathy, and their 3 sisters were forced to think about his end-of-life plan. In her research, Kathy came across a unique subset of science, brain donation. And with Eddie having been diagnosed with autism, his brain would be valuable in advancing research in that field.
We understood in our family, as Eddie's very wide circle of friends did, that he had a really beautiful mind. I mean, his brain was something very special. So the idea of his brain just being wasted was just horrifying to us. So I, as his legal guardian, had the responsibility of trying to think in his brain, think wearing his shoes, what would he have desired? And it really came to a head when he had pneumonia. And that was when we both put the DNR in place and also reached out to Autism BrainNet.
Autism BrainNet is a program of the Simons Foundation Autism Research Initiative. Its goal is to use brain tissue to understand the biological causes of autism and identify treatments that improve the quality of life for people with autism spectrum disorder. Dr. David Amaral, scientific director at Autism BrainNet, says that its creation 14 years ago stemmed from frustration of a lack of research opportunities.
I wanted to do post-mortem autism research to try and answer some of these questions. But when I went to the available sources of autistic brains, there really was on the order of tens, like 10 brains or 20 brains. In fact, we did a very large study in the early 2000s, and I think we had something like 22 brains in that study, and it was considered to be a large study. So we realized that we have all these incredible scientific techniques now to study the postmortem human brain. But the bottleneck was that we just didn't have the material to be able to enable those kinds of studies.
Since they're only being used for research purposes, brain donation isn't included in the standard organ donation registration. It requires a separate process that many people aren't aware of, which has proven to be a main obstacle for Autism BrainNet. While we have ways to look at the brain of a living person, Amaral says being able to explore the tissue up close provides invaluable information for various conditions.
Alzheimer's disease, which is getting more and more prevalent, was first discovered in 1906 by a pathologist who studied a woman who had dementia, and he was able to study her brain, and he discovered the plaques and tangles that are characteristic of Alzheimer's disease. So that was over 120 years ago. But because of that discovery, we now know what causes those plaques and tangles. And that has led to a variety of efforts to come up with preventative measures or treatments.
But while Alzheimer's research has seen major advancements in knowledge over the last century, other conditions like autism are just beginning to access this type of investigation.
We have just begun to acquire postmortem brains for doing research. And our hope is that by carrying out postmortem brain research, we'll be able to understand really the causes of autism at a cellular and molecular level. And that ultimately will lead to better treatments to improve the quality of life of living autistic individuals. So these brain donations are really a valuable and critical resource that enables state-of-the-art research to be carried out.
Research that was thought to be science fiction back when Amaral was a student.
The very first postmortem studies of autism weren't done until the 1980s, but again, on like 4 to 6 brains, not a very large number of brains. And it's only now in the last 5 to 10 years that people are able to do well-powered studies, and largely due to the fact that Autism BrainNet has been able to gather these donations from members of the community that see the value in this kind of research.
The donations can also be from non-autistic individuals whose tissues will be used as a control group in this research. There's no cost to the family, and Autism BrainNet handles all of the donation logistics. After someone dies, a loved one calls Autism BrainNet's 24/7 number 877-333-0999. The organization will dispatch a member to acquire the brain and ship it to one of their 3 collection sites. After Eddie passed, Kathy's sister called the hotline and arranged for the tissue to be collected at a funeral home.
We do require that brain donations come in within 48 hours after a person's death, but it's even better if the donation can come in within 24 hours or even shorter. And the reason is that when a person dies, all of their organs start to change, start to deteriorate, and we want to study the brain of an autistic individual as closely as it was to life as it can be. So the longer the delay between when a person dies and when we acquire the brain, the less likely it is to represent the brain when it was in the living person.
Once the tissue is preserved, after some time has passed and the family is ready, Autism BrainNet will reconnect with them to get more information about the donor's life.
What were they like? What kinds of characteristics did they have? We also asked them for their medical records so that we can see, for example, 30% of autistic individuals also have epilepsy. Well, epilepsy is a neurological condition as well, but we need to know that when we're studying the brain tissue from that particular donor because it has implications for the results that we see. We do all that to gather as much information and to confirm the diagnosis if the person was autistic to ensure that really they did have autism.
After that, the team reaches out each year to check in on the families and update them on the research their loved one's donation is helping with. Autism BrainNet also sends out a quarterly newsletter that anyone can sign up for that dives into the science that's being done with the donations. Each brain is able to be used by scientists around the world for decades to come.
And each brain can support research by hundreds of studies. So we realize that this is a valuable and precious resource, and we do everything we can to preserve it in an optimal way to make it valuable for doing science.
Amaral says this research is the only way we'll be able to understand the biomedical causes of autism.
We can look at the autistic individuals behaviorally. We can do MRI analysis of their brains, and all of that is important research. But to get down to the point of understanding the neurons and their connections and chemistry of autism, we need to look at the brain. And it's only that level of analysis that will ultimately lead us to better drugs to treat autism, as well as a lot of the co-occurring conditions.
When Amaral refers to treating autism, he doesn't mean curing it. The goal of treatment is to improve the quality of life for autistic people, not reprogram the DNA of who they are.
We're not necessarily doing this research to cure autism. There's many positive aspects of autism, and Kathy mentioned several about her brother and what an incredible artist he was. And where our goal is to try and understand what causes some of the debilitating co-occurring conditions like epilepsy or anxiety.
A large portion of people with autism have anxiety conditions, serious sleep disorders, and gastrointestinal issues as well. Amaral believes that by studying the brain, they can figure out what's causing these debilitating conditions and be able to treat the root of the problem.
And from my perspective, if we could simply treat the anxiety component of autism and reduce or eliminate anxiety from an autistic person's life, it's going to make their life that much better. And that's what our goal is, to make the lives of autistic people that much better.
Amaral says the current anti-anxiety medications on the market don't work the same way in people with autism as they do in neurotypical patients.
A lot of the anti-anxiety medications that are used for neurotypical individuals actually have been tried. Many of them actually do not work as well in autistics as in neurotypical individuals. So there is not a standard of practice at this point in time for an anti-anxiety medication in autism.
Even non-pharmacological treatments like cognitive behavioral therapy don't work in the same way for these individuals.
We're really in the early stages of evaluating how well that works in autistic individuals. And again, part of the issue is that we do believe that the autistic brain is different in some ways than a neurotypical brain. Those differences may make some of the drugs that we use for treatment of anxiety or sleep conditions actually work in not as expected. In some cases, they work in the opposite way. So an anti-anxiety medication may make somebody more agitated. So we need to understand that. We need to know, what are the best treatments for these kinds of conditions in autism? And that's what our goal is.
People with autism not only have structural differences in the brain compared to neurotypical people, but also with others on the spectrum. A popular phrase in this community is, if you've seen one autistic person, you've seen one autistic person. There's a ton of diversity in this community that isn't yet well understood, but has an incredible impact on each person. Amaral is able to show this through his work looking at the amygdala, a brain structure that plays a big role in anxiety, at least in neurotypical people.
And we've studied the amygdala, just looked at its development over time using MRI in living autistic children. So we followed them from when they're 2 years old into their 20s. And what we found is that anxiety in autism can actually be of two varieties. It can be the standard kind of anxiety. It's called the DSM type of anxiety. That's what any neurotypical person would have. But then there's also an atypical form of anxiety that seems to be only occurring in autistic individuals.
This type of anxiety is often related to patterns. If something is different than it appeared the day before, a person may get really anxious about that change.
So one of our children was upset when there was a cloudy day and the sun didn't rise the same way as it did yesterday. And, these are things that neurotypical individuals wouldn't necessarily be anxious about, but this child needed to have things done in the same way exactly every day. Otherwise, they got anxious.
What's interesting is that the kids with the typical type of anxiety had larger amygdalas than kids without any anxiety, but the ones who had the atypical presentation had smaller amygdalas than both groups.
So here you have, even within autistics, a divergence that some had a big amygdala, had DSM anxiety, some had a smaller amygdala, and they had this atypical anxiety. But then there was a group of autistics that had no anxiety disorder that we could determine, and their amygdala was normal size.
Which is just one example of how diverse this population is and how much we don't understand.
And it speaks to the issue of why we really need a large number of donations of postmortem brains. By looking at one brain, it really will not characterize all of the differences we see between autism and neurotypical individuals. We ultimately would like to know what's different about an autistic individual that has autism plus anxiety versus somebody who only has autism, or autism plus epilepsy versus somebody that only has autism. And the only way you can do that is by having a large number of people with autism plus anxiety or autism with epilepsy comparison to autistic individuals with neither of those, as well as comparing it with neurotypical brains that don't have autism.
At this moment, Amaral estimates that they've collected around 400 donations. It's much more than what was available several years ago, but he says many more are needed to get the answers they're looking for.
I think there may be some novel findings that we'll see in the autistic brain that will give us clues as to why some of the medications that we think should help them are not helping them. And then there'll be other findings that will lead us to new targets for therapy. So science, unfortunately, is slow and it takes some time. And this is, I think, in compared to something like Alzheimer's disease, autism is far more complex. And so it's probably altering or affecting multiple brain systems, not, one or two. And we need to encourage more research on all of them. But again, unless you have the substrate to do it, which in this case was the postmortem brain, you can't do the science.
You can find out more about brain donation and Dr. David Amaral on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our executive producer is Amira Zaveri. I'm Kristen Farah.
Coming up, how prevention can lower your healthcare costs when In Good Health returns.
Behind every mile of rail and every ton of freight, people and technology work side by side, making rail safer and more reliable. From sensors that detect what the eye can't, to VR training that prepares railroaders for any scenario, freight railroads are investing in real-world solutions. The equation is simple. Human grit plus advanced tech equals a stronger, safer tomorrow. Learn more at aar.org/America's Engine.
For my family, I'm always at my best. That's why I also want the best in my kitchen. And that means only Eggland's Best Eggs. They're always so fresh tasting and delicious, with 6 times more vitamin D, 10 times more vitamin E, and 25% less saturated fat than ordinary eggs. So why give your family less when they can have the best? Eggland's Best. Better taste, better nutrition, better eggs. For added convenience, look for our hard-cooked peeled eggs.
If you look around, so much of our lives are designed with prevention in mind. From the seatbelts in our cars to the lids on our coffee cups, we're staying proactive. A strategy that saves a lot of money, time, and frustration.
Can you imagine a world where we don't take fire prevention very seriously? We have structures that aren't built to prevent fires, where we don't have fire alarms, we don't have fire safety in everything that we do. And we see actually the consequences in some places, like what happened in Los Angeles. There was a wildfire, but it spread very rapidly. There was a lot that could have been done, more that could have been done.
That's Dr. Barry Davis, Professor Emeritus of the University of Texas School of Public Health. His new book, The Preventioneers, Diseases, Disasters, and the Discoveries That Changed Our World, highlights the brave people who've pushed against the status quo. While prevention is now baked into so much of our lives, society doesn't often like change, and many of these normalized ideas were once considered taboo or offensive. For example, it took decades after the invention of modern cars before passenger safety was prioritized.
It was just accepted when the cars came out that, the crashes would happen. It was people. They didn't drive right. They weren't paying attention, and so on and so on. But then there were a few doctors who saw the tragedies of these car crashes. It was like a plastic surgeon or an ear, nose, and throat doctor or a neurosurgeon. And they saw the consequences of what was happening. And they realized that there was something wrong with the car because, okay, the car is going to crash, but you're inside the car and something's going to happen to you when that stops. And they came up with all these ideas about seatbelts and padding the dashboard and retractable steering wheels and eventually airbags and so on and so on.
Yet, it was a challenge to convince other doctors to support the movement, and it took years to create public policy around it.
And even after the legislation, which occurred in the 60s, it was quite a while before seatbelts were put in cars, but quite a while before most of the states made them mandatory to use.
There's a running theme with all the major prevention efforts Davis highlights, which is they're almost always met with extreme hesitancy from the public. You may be shocked to hear that one of the more controversial ideas was in the mid-1800s. Hospitals had high rates of maternal mortality due to childbed fever, which is caused by a bacterial infection in the reproductive tract. They couldn't figure out how to prevent the condition, but one doctor suggested it may help if physicians started washing their hands.
Now, nobody knew anything about germ theory back then. They didn't know how infection spread. They didn't really even think so much of infection. And then the prevailing theory was that there was something in the air, it was called miasma, that caused things. And he realized after a while, it took him a long time to realize it, and it sort of came to him as an epiphany, that what was causing it was the doctors were going from the autopsy room where they had examined patients right to examining women who were pregnant. And he realized they were carrying something. And he could smell the autopsy particles on his hands, and he realized that he has to get rid of that smell. And he came up with this chlorine washing.
One hospital instituted this practice and saw an immediate reduction in childbed fever cases. Despite this success, the medical world refused to accept hand washing was the answer.
First resistance was that was the prevailing theory of the day. What are you talking about, Dr. Semmelweis? The second was, you're telling us that we're not clean? We're physicians. Of course we're clean. The third one was that he was a junior person. He was also a foreigner. He worked in Vienna, but he was from Hungary. And he was telling senior people that this was the solution. And they said, well, you really need to provide more evidence. And he started to provide evidence, and they kept on saying, well, that's nice, but you need to provide more. And they just really wouldn't listen to him. Some people did, but most people didn't.
Dr. Semmelweis died before seeing the impact of his work. It wasn't until years later with the advent of germ theory that people recognized how brilliant he was.
We meet resistance all the time in our everyday lives. If we want to say something, this is not quite right, people say, well, that's the way it's always been, or what proof do you have? And you show proof, and they say, well, that's not really much proof. We need more proof, and so on and so on. And the resistance built up. These people who fought this were fighters, and they found ways to persist and to get their ideas out. Not everyone was successful. Semmelweis was one that was not successful, but the others were.
In his research, Davis realized that it takes a special type of person to create necessary changes in this world.
They see something wrong. They see that something can be done about it. They have to gather enough evidence to convince others. You have to use that evidence to make change or for people to have political will. And then that political will has to be institutionalized somehow so that things will get done.
It takes continued persistence, standing up for your beliefs even as the rest of society fights against it. Despite the initial pushback that often happens with a new idea, many people come around to prevention-first thinking once they realize how it not only benefits society, but it saves everyone money.
It's a lot cheaper to, get checkups, take your medicine, watch your diet, exercise, than at the end have something big go wrong. I mean, everybody sees the thing with the person who has a big heart attack or a stroke and the amount of effort that goes into treating them or fixing them up, and you get that hospital bill, $50,000, $100,000. But you take the blood pressure medicine and you follow it religiously and get it under control, and it's, pennies a day.
But one of the biggest obstacles to creating prevention policy is that the success is invisible. Once a problem is solved, the next generation is quick to forget what life was like before specific programs were put in place. Davis says we can clearly see this cycle happen with vaccines.
People forget what it was like when measles was present all over the population. People forget what it was like when polio was there. People forget when smallpox was there. Now, thank goodness smallpox has been eradicated from the face of the earth. It no longer exists as a disease. But when things are well taken care of, people tend to forget. And we need to remind people constantly about things. We always do that. We need to look to history and remind ourselves of the way things could happen and what we need to do to prevent them from happening again.
Today, Davis says we may be seeing a turning point with social media.
There is a movement that started by Jonathan Haidt called the anxious generation, where there's a lot of evidence that this constant access to telephones and social media at a young age is doing something that's not good for the kids.
Davis says there's legitimate pushback from other scientists in the field. They worry that there's not enough evidence to prove it's actually social media that's causing an increase in mental health issues. Davis thinks it's a very similar debate to what we saw when trying to regulate cigarettes.
First of all, there's a huge industry pushback. In the case of smoking, it's the tobacco industry. In the case of this problem, it's the big tech industry. But the other thing is even the science. There was a problem at the beginning with smoking. Was this causation or was this correlation? Did you just see two things that come together, sort of coincidence, or was one causing the other? And it's the same thing here. And you just have to gather more evidence. But there comes a point at which how much more evidence do you need to gather before you act on it? It just seems strange that you keep on wanting, your goalposts keep moving. You want to keep on getting more and more evidence when you feel that something should be done.
Some countries have already started to take steps towards regulating social media. Australia instituted a ban for teens under 16, and France has a similar law for kids under 15. Other countries like Spain, Brazil, and Greece aren't far behind with their policies.
The warning signs are there. The evidence seems, to my mind, to be there, but I'm very willing to have science talk about it, but just not forever.
His book, The Preventioneers, is available now wherever books are sold. You can find more information about Dr. Barry Davis and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.
In Good Health returns in just a moment.
Behind every mile of rail and every ton of freight, people and technology work side by side, making rail safer and more reliable. From sensors that detect what the eye can't, to VR training that prepares railroaders for any scenario, freight railroads are investing in real-world solutions. The equation is simple. Human grit plus advanced tech equals a stronger, safer tomorrow. Learn more at aar.org/America's Engine.
Medical notes this week. A simple nasal spray could be the future of reversing cognitive decline. A study published in the Journal of Extracellular Vesicles reveals a treatment that suppresses chronic inflammation in aging brains. In animal models, the nasal spray significantly improved memory and switched on the brain's own repair system. This non-invasive approach offers a promising way to treat age-related diseases. Giving antibiotics to newborns may come with a hidden cost. New research reveals that early life antibiotic use disrupts the delicate balance of the gut microbiome, leaving infants vulnerable to infections. These findings suggest that clinicians should exercise extreme caution with antibiotic prescriptions in the first weeks of life to prevent lasting damage to a child's developing immunity. The research is published in Mucosal Immunology. Many beauty products marketed as clean have a dangerous secret missing from their labels. 70% of products tested in a recent study listed fragrance as an ingredient, which can hide endocrine-disrupting chemicals. This study highlights a critical gap in cosmetic regulation and underscores the need for better labeling. The research is published in the Journal of Exposure Science and Environmental Epidemiology. And finally, a high-fat diet may be bad for your brain. The gut is commonly known as the second brain due to the millions of neurons in the digestive tract. However, new research shows that this gut-brain connection works both ways and may be making us vulnerable. Research in PLOS Biology shows that live bacteria from the gut can travel into the brain. This animal study revealed that a high-fat diet increases the amount of bacteria in the brain, potentially causing neurological diseases. And that's Medical Notes this week. I'm Mayan Vasta Betancourt.
America's privately owned freight railroads keep the nation on track, investing $23 billion a year, 6 times more than the average manufacturer, to deliver safe, reliable service. That's how railroads move 59 tons of goods for every American each year and help their customers grow. Railroads do all this while offering some of the safest, best-paying jobs in the country, supporting families and driving the economy forward. Learn more at aar.org/America's Engine.
Thank you for joining us this week and every week as we break down the science stories you need to know. You can find all of our past segments and guests on our website at ingoodhealthpodcast.org or wherever you listen to your podcasts. Follow us on Instagram, Facebook, and X for more behind-the-scenes content. Tune in next week for another edition of In Good Health.
Behind every mile of rail and every ton of freight, people and technology work side by side, making rail safer and more reliable. From sensors that detect what the eye can't, to VR training that prepares railroaders for any scenario, freight railroads are investing in real-world solutions. The equation is simple. Human grit plus advanced tech equals a stronger, safer tomorrow. Learn more at aar.org/America's Engine.
Amazon presents Laura versus fruit flies. Hide your bananas. These winged demons came to your kitchen to do 2 things: eat fruit and and they're all out of fruit. But thankfully, Laura shopped on Amazon and saved on cleaning spray, countertop wipes, and fly traps. Hey, fruit flies, your baby boom ends here. Save the everyday with Amazon.
Amazon Health AI presents Painful Thoughts.
I can't stop scratching my downtown. Yeah, but I'm not itching to go downtown and tell a receptionist I'm here to talk about my downtown. Some things you'd rather type than say out loud.
There's no question too embarrassing for Amazon Health AI. Chat your symptoms and get virtual care 24/7. Healthcare just got less painful.